Good afternoon, everyone, and welcome to the EUPATI Open Classroom webinar, 1 year online progress in learning. Thank you very much for being here. My name is Silvia Scalabrini. I work for EUPATI, and I will be moderating the session today. We have got a fantastic agenda to go through, but before we do that, I would like to go through a couple of housekeeping aspects with you. So, due to the large number of attendees, you will be automatically muted so that we can avoid some background noise. The webinar is being recorded, and we will send out the recording along with the slides in the next few days so that they can be made available to the people who couldn't be here today. We also got some allocated time for the questions. Please feel free to actually use the Q&A function in the Zoom. We will monitor that, and we will make sure that we can address those questions during the session live, but we will also collect all of your questions, and then we can circulate and make sure that you get an answer to all of your questions. So thank you for that. So without any further ado, I will now leave the floor to Cora Scholten and Maria Dutarte for a very warm welcome to all of you. Thank you.
Thank you so much, Silvia. I would like to welcome you all to this great webinar, and it's great to close the year with something nice after all those circumstances. And with this, and a warm welcome, I hand over to Maria.
Thank you so much. I'm honored to welcome you to this webinar on behalf of EUPATI, as today's topic also focuses on our main mission and our core activity, which is patient education. We believe that involving patients in the medicine's R&D process has important benefits, and by bringing in their priorities and perspectives, patients can contribute to developing better treatments for themselves and others. And to enable this, it is essential that patients have thorough knowledge of the processes and methods by which medicines are developed and how they can make a meaningful impact. Since the EUPATI Patient Expert Training was launched 5 years ago, we have seen that this education truly empowers patients to work effectively with the relevant stakeholders and strengthens their role as a key contributor. We are therefore very excited to be sharing some latest developments about this program and the Open Classroom platform with you today. Thank you. Now back to you, Silvia.
Thank you, Cora, and thank you, Maria. So I'm very excited to introduce you to our first speaker from EIT Health, Jeff Wilkesmann. Thank you and welcome, Jeff. Over to you.
Thank you very much, Silvia. So it's a real pleasure being here with you, with all of you here today. I cannot see all of the audience, but it's a real pleasure, and I'm very delighted to at least for you to get to know a little bit better what EIT Health is and what we do. So the main idea behind EIT is the innovation. So we have this slogan coming from EIT that we power innovators and entrepreneurs to develop innovative solutions to global challenges and create, therefore, growth and jobs for Europe. So this is a very remarkable slogan that goes on and on, how this will actually be coupling with what we do, you will see in my next slide. So this EIT unique approach to innovation has many components. So there is, of course, this capacity building where the education, let's say, element is a very important and key element in order to provide a tangible way of obtaining innovation. But then, of course, the participants gain a sense of competitiveness, what's going on in the society, and of course, the main idea behind is to increase the quality of life among the European borders. We see, of course, that all the participants or members involved in EIT Health are actually attached to an innovation ecosystem that the idea is to grow stronger and wider each day. And of course, to tackle these societal challenges in the health area in our case. And therefore, we are able to offer some unique features. So concretely, in my next slide, you will see then the evolution of EIT Health. EIT Health is, of course, a body created by the EU already from 2008, but EIT Health exists already from 2015, and we're one of the members of the EIT community. So besides EIT Health, you will see EIT Climate, Digital, Food, and so far. And there you will see this roadmap that how our achievement have so far been, the total investments so far provided, and the amount of jobs created, which is huge. And of course, this is there was this need to have this kind of organizations to be implemented in European rooms. So for my next slide, thank you. You will see that EIT Health, the central office is located in Munich, and I'm actually working at the hub in Germany, but located in Mannheim, Heidelberg area, and we have several offices across Europe. And if you have, or you have the need to contact us, just feel free to approach us at the closest office that it's available for you, depending where you are located, as I assume you're coming or you are based at different locations here across the European map. Of course, nowadays with an email, you can reach everywhere. So next slide, please. So this is part of the team at the German hub. As you can see, it doesn't seem that we are not that much, but we are very, very efficient. And we cover all the partner regions that are actually located in the German-speaking area, Germany, Switzerland, and Austria. However, I must inform that beginning 1st of January next year, the Austrian hub is officially inaugurated, so they will have their own EIT offices. Next slide, please. Yes, thank you. So we have three basic major goals, okay, that are there highlighted, and you can see in the different colors that will be there: the strengthening of healthcare systems in Europe, promoting better health of citizens, and of course, contributing to a sustainable health economy in Europe. Now, how we are able to achieve those goals, you will see in my next slide. And there you will have a lot of information written. However, what we actually care about are these focus areas that are highlighted in those beautiful colored circles. So those focus areas is more or less how we are able to tackle our main goals. So that would be reforming care pathways, healthcare transformation, harnessing real-world data, bringing care home, health in the workplace, and fostering healthier lives. So EUPATI, of course, is a beautiful example on how the integration of these focus areas contributes to the overall goal of achieving a great potential in health and delivering health concepts and health education across European citizens and beyond. Next slide, please. So our unique approach, perhaps this is not as interesting or relevant for you in the journal, but our approach to achieve this integration or to achieve our solutions is to interconnect the relationships between education, business, and research. This is what we call this knowledge triangle, where then the solutions are being involved through the collaboration, through the integral collaboration among these different, let's say, components or stakeholders from the society. Next slide, please. That is correct, with the circles. So how are we organized at EIT Health? We have three main pillars. So the innovation pillar, education pillar, and business creation pillar. And each pillar has a specific objective. Of course, in my case, I am the lead of the education pillar, so we attend exclusively educational programs. But for those who are interested in perhaps having funded some kind of innovation project, then those are guided through the innovation pillar. But also for those of you who might be interested to create their own startups or have an SME or just are a freelancer entrepreneur, then perhaps the business creation pillar might be an optimal solution for you in order to gain more information and eventually funding for your startups ideas. Just feel free to click on those three items once you visit our website. Next slide, please. So in EIT education, many people think that we are only concerned in master and doctoral programs, but we actually cover more than that. And one of those examples is exactly EUPATI. So beyond those, let's say, classical or traditional educational programs, we are also able to offer executive training and postdoctoral courses, lifelong learning modules and MOOCs, continuous professional development. And once you participate in our programs, of course, you also gain access to alumni networks, okay? And a slide about that will come then afterwards. Next slide, please. So just to mention some success stories, of course, and for the next one, it will be evident that it will be you. But before we go into those success numbers, here's more or less a brief summary of how the numbers look like. So you'll see here investment attraction by startups so far. Beginning from 2017 to 2020, you see basically a huge increase of reaching numbers up to 363,000 millions in startups. The number of startups supported, you can see it's racing from 120 to 490. And graduates and professional trained so far, we are over the 10,000 participants. So in the next slide, you will see then the EUPATI Reload as an example of success story. So we are very, very enthusiastic with this approach of EUPATI Reload. And we have been very, very satisfied with their results. So next slide. Besides EUPATI, of course, there's a kind invitation for you if you are willing to gain more insights about the EIT Health Alumni Network. Just feel free to join that network, and you will find more information about how to participate in additional trainings and find other interesting information that will be there posted. For the next one, because I really need to wrap it up because of time reasons. If you have the needs to contact us, just feel free to do it. Keep up with the information by subscribing to our newsletter. And for more detailed information about our upcoming programs, that will be the 2022, you can also do that by clicking those links there. So for my next slide, I appreciate your attention, and I go back to you, Silvia.
Thank you, Jeff. Thank you very much for your presentation. So I will now hand the floor over to Natacha Liti. She's one of our EUPATI fellows, and she will give you an overview about her experiences with EUPATI. Thank you, Natacha. Over to you.
Thank you, Silvia. Hello, everybody. So I'm Natacha, and this is my graduation photo. So next slide, please, Silvia. And my story. This slide is only serves only to contextualize that I'm a person who works in clinical research, that has a background in oncology, that has worked for pharmaceutical industry. And yet, when my brother was diagnosed with a rare form of melanoma at the age of 45, I felt I knew nothing. And we didn't know what to ask. We didn't know what should we demand, what we were entitled to. And so it's just to contextualize that in a very humble way, I became, in a very violent way, I became very humble about the story and about what I thought I knew. And so next slide, please, Silvia. We went through all the steps of a rare diagnosis, and we really felt like the cartoon that I brought you for you today. Like we almost felt like we had to ask sorry to the teams because of what disease my brother had. So we went through misdiagnosis, then a late diagnosis, and then we realized that there was no experience with this disease within the medical teams, and that there was a really lack of approved treatments, and the communication gaps were huge. So at this point, we were pretty sure that we needed help. And we were pretty sure that maybe we could engage and with people that were in the same or had been in the same situation. And I also thought about something else at the time that was, okay, if I feel so privileged with the information that I have, how do people that have lower health literacy, for example, feel when passing through a situation like this. And so help came from EUPATI. And Silvia, please, next slide. Well, I applied to the third cohort at EUPATI and I was accepted. And what happened is that EUPATI gave me access to a program that was on one hand easy to understand and at the same time very complete and comprehensive. For me, it was really important to have the tests and the self-assessments because some items, for example, I had never heard about HTA, and for me it was something really new. And sometimes it was important to make these tests and then go back and read again the models. So this possibility of repeating the models was very important at the time. It was also really important for me the availability of trainers and fellow students, and most of all the creation of this network of advocates that comprehended people like me that at the time was really an inexperienced person to really experts, patient experts, with whom I still today exchange ideas, do partnerships, and stay in contact to learn. So this was really, really important because EUPATI and the training course made me feel I was not alone, where my ideas were not crazy ideas, or at least there were more people with these crazy ideas, and that it was possible to do patient advocacy and to give empowerment to patients. And nowadays, I'm a bit more experienced, although I still have a lot to learn. And I still use the EUPATI and the Open Classroom because it's important to keep updated. And so it's a really nice system that also for someone like me that is already a EUPATI fellow to keep updated with the items. So next slide, please, Silvia. I think this slide is very important, and probably many of you have already seen, and many of you heard a lot about patient centricity, and everyone agrees on this, but it's really difficult to put it into practice. And it's really important to have patients involved in research and development since the beginning, but it's really hard. And that's why EUPATI is important, because patient education and patient engagement have to work together. And EUPATI gives us, as patients or patients' carers or representatives, this power of having the education so we can engage in a really meaningful way and be recognized by all the stakeholders as really relevant and important partners as we definitely are. So, Silvia, next slide, please. My concluding message, I choose three of them. One of them is the cartoon that I'm presenting you. To say you are really experts in your disease. Okay, you might not be a doctor, you might bring a different kind of expertise, but never doubt that you are the expert, because you are the person that after the doctor's appointment go home and still has the disease and lives with the disease. So you are experts no matter what. So if you get more education, you'll be a really powerful stakeholder in this environment. The second message is that you have a voice to say. Sometimes, and even when my brother was diagnosed, I didn't have, my voice was a bit low because I didn't know my rights, and sometimes it's difficult to ask the questions we feel we want to ask, but maybe we will not do it one day, but we'll do it next. So your voice is important. It's not always easy to put this voice out loud, but you do have a voice, and it's really important. And last but not least, meanwhile, I founded a patient association that advocates for patients that have a melanoma diagnosis in Portugal. And so if you have any questions, if you want to talk further, if you want to exchange some ideas, because I think I have to learn a lot with all of you, I'm pretty sure, please feel free to contact me. And so next slide, please, Silvia. I just wanted to thank you and leave the room for the next speaker and for all of your questions. Thank you so much.
Thank you, Natacha. Thank you for sharing your story. That was very inspiring, and I'm sure that will inspire other people as well to get interested to join EUPATI as learners in the future. So thank you.
Thank you. Thank you.
I will now hand it over to our next speaker, Matthias Gottwald, and Matthias will tell us a bit about his experience in the transformation of the EUPATI Patient Expert Training Program. Thank you, Matthias, and over to you.
Yeah, thank you, Silvia. I'm glad, and warm welcome from my side. I'm glad to be here and share some observations and thoughts on the transformation. As you have heard, we have the expert training course, and it works well, as you can see from patients like Natacha, who are really empowered and use the course to do something great in the community. Nevertheless, the former course was a 14-month blended learning expert training course on the Moodle platform, 6 modules, with logistics and IT infrastructure that limited us to about 60 patients who could be trained per year in cohort, which is good, but definitely not sufficient. And that's why I'm very glad and would like to thank here EIT Health for the funding for our EUPATI Reload project, which started 2 years ago with the goal to transform the current course into an online, on-demand, flexible course, repackaged again 6 modules, but with individual around 30 training units, which could be taken with an individual certificate and where we are not limited in the number of seats. The overall aim of the project was and is to significantly increase the potential number of participants from the patient community, but also other stakeholders who are interested, because we want to help more and more people to be empowered to contribute to the innovative medicines research and development. And we can and need the support from all experts who are in that field. This transformation is part of the long-term sustainability approach of this expert training. And we wanted to make it, as I said, much more flexible. The learners can use the material depending on their needs, on their preference, their intended speed. For example, they can go for an individual training unit, they can go for a module consisting of several training units in a specific area like HTA, or they can go for the full EUPATI Fellow Program. We have this year focused on repackaging and transforming the last 2 modules and very big modules on regulatory affairs and HTA, and also to extend the scope. And you will hear in a few minutes by Alicia and Paula about the 2 new modules that we added on medical devices and digital health to expand the scope with areas that have become more important in the recent past. Next slide, please. Just a word on the process. We applied the overall quality standards that we use in EUPATI. So we asked for the authoring of the new content and the update of the existing content experts in the respective area. And they looked at the restructuring of modules also, and lessons where appropriate to make it more readable, user-friendly. We then had, as for all content within EUPATI, a review by a cumulative multi-stakeholder group consisting of EUPATI fellows, EUPATI staff, industry, academia, and experts from regulatory and HTA were required. And this group also, after their individual review, had joint group sessions for each course and each lesson to come to an agreed final text and document, very often requiring multiple review sessions. And then we had the next step, which is also an intense part of work, to have the upload in the learning management system, requiring some format changes, adaptation, and a final check of links. And that's what we used as approach. Next slide, please. And we are really glad that it went overall so well. We launched the first four modules a year ago, Already middle of this year, we had more than 200 registered learners, and more than half of them are aiming to become a EUPATI fellow by taking the full course. We have focused this year, as I said, on the modules on regulatory affairs and HTA, and they are just in the course of being launched. And very early next year, we will have the additional courses on medical devices and digital health becoming available. Next slide. So what is new and what was the main work we had with our two modules on regulatory affairs and HTA? There have been many changes in the regulatory framework over the last couple of years. For example, the clinical trials regulation, regulation on pediatrics, the European data privacy regulation came into play, and others. And we had to adapt there a lot. We had and realized that we had to add more content on areas like the good practices and adherence and try to fill gaps there. And where appropriate, we also added content to the existing lessons and recommendations for further reading. So a bit more going into a textbook structure. Same in HTA, where the landscape over the last 10 years has changed dramatically, with more and more agencies in various countries taking responsibility, where the infrastructure and the main methods developed, and we added more details. And fortunately, more and more opportunities for patient involvement have developed, and we have a new course on that field as well. Next slide. Just to give you an idea, without going into the details here, what you can see here is the transformation process, just as an example in the regulatory field. On the left side, you see all the lessons that existed in the past on regulatory affairs. And we looked into that. We updated all individual lessons. And then we looked what would be a more logical and meaningful structure for the patient. And so we reorganized the whole content then in another 5 courses, with a more introductory part, focus on epidemiology, pharmacovigilance, product information, and also the market authorization procedures, brought them into a more logical structure. I just see from the chat, Maria, thank you very much, that we have more than 340 users of the platform. I think that's really great. Just a few observations from the process that we went through. As I said, and we realized that when we started to go through all that content over the last 2 years, that many changes have occurred in the regulatory and HTA environment over the last couple of years. And that brought us into the challenge that we had a much more intense work than originally expected and planned. We had a slight delay during the project, but nevertheless, I'm really glad that I can report now that we are complete with the transformation of the content and the updates, and are now in the process of uploading the final documents in HTA and regulatory affairs. We had multiple review cycles of this editorial group up to weekly meetings, and this is something I really appreciated. It was the philosophy of EUPATI over the whole 10 years, and we applied it always, the multi-stakeholder approach to have different perspectives and come to an unbiased, high quality, up-to-date content. But here we also applied it, and it was really a pleasure in that group. It was extremely constructive and valuable. And the same approach with the co-development by multi-stakeholder groups was applied in the medical device and digital health field. And you will hear more about that by Alicia and Paula in a minute. Next slide. This open classroom approach, the expert training course in this new format is obviously working, and I'm really glad that this transformation adds value also from the user perspective. And it will be, and it is already and will stay also a key pillar in EUPATI's sustainability strategy. And that brings me to my last slide. I would like to thank you, first, all of you who contributed to this transformation in the regulatory and HTA field, and that review team consisted of Maria Dutarte, Stine Haller-Felleberg, Anja Hoffmann, Lotte Klim, Silvia Scalabrini, Cora Scholten, and Wolf See. And I would like to thank all of you for your attention and hand over to Paula and Alicia. Thank you.
Thank you, Matthias. Thank you for providing us with a very comprehensive overview about the repackaging of the module, and also really for being able to give us a very good feeling about the huge amount of work that went into this project. So thank you once again for all the work and for all the people that contributed to this amazing project. Thank you. So I will, as Matthias already anticipated, I would now like to hand it over to Paula Wray and Alicia Panadero, and where we'll just give, it will be a double act really, and where we'll give us an overview about the development of the two new modules, so medical devices and digital health. So we can start with you, Paula. Over to you. Thank you.
Thank you, Silvia. Next slide, please. So yes, just to give an overview of the development of the medical devices module, it, like everything that EUPATI does, involved a wide range of stakeholders. Initially work was done by the EUPATI fellows who looked to plan what needed to be involved in the module, what content was needed. And this information was then brought to a workshop with more wider stakeholders from industry, universities, patients, public, EUPATI fellows, and they're sort of listed on the slide here. But I'd like to take this opportunity to really thank everyone involved, but particularly the EUPATI fellows and Devices for Dignity, as they all contributed so much to ensuring that the patient voice was driving the development of this module. And we obviously, our industry academic partners, were able to bring their technical expertise, knowledge and experience to really support it in what has felt like a very balanced process, with no voice being stronger than the other, which I think is hopefully you'll see in the end product. The workshop we hosted back in April established the framework for the module, the order, what was important, and identified the key areas for content development. And many of the majority of the participants of that workshop became members of the authoring groups, and we're incredibly grateful for them for taking on that next step in the process. They focused on the areas where they had interest, expertise, or lived experience. And the group met regularly over the course of the development to add content, such a wealth of content, practical examples, videos, and everything. So it was great to see how this module just came together. The next step in the process was to review the content, as Matthias said, which was led by ourselves, Medtronic, and the EUPATI fellows. Again, went through several review stages before going to the editorial board in October 2021. Based on the feedback from the board, it was sort of too much detail in some areas, and the readability could do with improving in the sort of the content and structure. So we're very pleased to announce that we've just had the final version back from an external writing company, or Excel, who we've been very grateful to, because they were able to turn this around very quickly to be able to then upload the new module into the Open Classroom next year. Next slide, please. Thank you. Essentially, the medical devices module is 76 pages long, comprising of 4 components, each of them covering a wide range of topics. And they're designed like other elements in the EUPATI course, so that the learner can go on their own journey. They don't have to follow a linear route. They can choose their areas of interest and then go back to other areas when they've got more time or as their interest develops. They all cross-reference, and the 4 areas as listed here are the introduction and the history of medical devices, regulations, and as Matthias said, they've all been changing dramatically very quickly, so that was a bit of a challenge. A roadmap, and Natacha kindly put up the linear path for medicine's development. Devices don't follow such a linear path, so it was important that we had a roadmap that reflected the patient journey in the device development process. So we've got that, and obviously all the relevant legislation, practical examples, which we hope will bring the content to life, definition of our concepts and terminology, because different countries use different terms, and that can often be very confusing in any field. And the classification of different, what is a medical device is the fundamental issue. Finally, the patient's roles in market access, health technology assessment. So please do watch this space for this new module. We will continue to evolve it and update it over the coming year as more things come to light and more examples come in. So thank you very much. And over to Alicia.
Thank you, Paula. And over to you, Alicia, now to talk a bit about the digital health module. Thank you.
Thank you, Paula and Silvia. I'm Alicia Panadero. I'm representing here today my company, Medtronic, which is one of the partners of the EUPATI Reload project funded by EIT Health. As Matthias said before, apart from the medical devices module, we have been working these past months in the digital health module. Our trip started in May 2021 with a multi-stakeholder introductory workshop. We agree on this workshop on the structure and the different topics to be included in this brand new module for the Open Classroom. Once this was done, between May and September 2021, different contributors were approached for providing the support in terms of providing inputs to develop the content of the new module. These contributors were from different organizations, different backgrounds and expertise, in order to try to include different perspectives in this new module. After that, in September, we carried out another webinar to refine the content structure that was presented in May, and we discussed the division of work between the different authors proposed. After that, from September to November, a small group of authors from different organizations, as you can see here in the slide, from Trinity College Dublin, Medtronic, Oxford University, EUPATI Fellows, and EUPATI Netherlands, we developed the content for the module. And after that, we just submitted the content that we have developed to the EUPATI editorial board. We already have their comments, their thoughts on the content that we have been developed. Although the content is complete at this date, we need further refinement to upload these inputs in the Open Classroom, and this will take place by January 2022. And at this point, I want to highlight the multi-stakeholder approach we have been following these last months. As I said, we are coming from different organizations with different backgrounds and expertise, and it was very fruitful to have these discussions with you. And also a special thank you to the EUPATI Fellows and the patient perspective we had for creating this digital model, because at the end, this module will be for patients. So thank you, all of you, for participating. Next, please, Silvia. And as you can see here, we developed a content for this module that in the first webinar, we stated which all of the areas of interest we wanted to cover in this content. So as you can see here, we go through different concepts and topics, such as electronic patient and healthcare records, the data collection and how it's important and why it's important to this digital health domain, digital health literacy, which are the disruptive technologies in this sector, the patient role in digital transformation, and some successful examples on this, the technologies that supports this digital transformation, and also how we develop digital health solutions and how they are procured in the ecosystem. And finally, concepts such as infrastructure and infrastructure. As you can see, this is a very wide domain. So we made a lot of effort to try to collect all the different aspects and topics to be able to transmit properly our message. And finally, I want to encourage you, the audience, to stay tuned to EUPATI communication channels, because medical devices module and digital health modules will be uploaded early 2022 to the EUPATI Open Classroom. So you will have the opportunity to go through this content. So thank you all for being here. Silvia?
Thank you, Alicia. Yes, thank you, Alicia. Thank you, Paula, once again. This has really been a wonderful journey, the development of new content for medical devices and digital health. So we're really just excited, but also we're really proud of all the work that's been going into this content. So yes, watch this space, and next year you will be able to access that. So thank you. We've now also got Ieva Lukase. She's a colleague from EUPATI, and she's just basically just going to show you a few features of the Open Classroom. So just for you to get a feeling about the functionalities and what can be done in the Open Classroom. So Ieva, I will hand it over to you. Thank you.
Hi everyone. Thank you for being here. And what I'm going to do, I'm going to share my screen, and you won't be able to read the details, but it's, as Silvia said, it's about the impression, it's about the encouragement and a bit of a context, how Open Classroom is now organized, because it might have might look different than 2 years ago. And remember that it exists actually only 1 year. So when I get too much frustrated about things, I think this is a fairly new thing. So we are all learning how to work with that. So I'm gonna share my screen, this one. So this is, if you type learning.eupati.eu. Oh, no, I have to click on share. So do you see my screen? I believe so.
Yes.
So this is the landing page of Open Classroom. All the things you heard today, this is where it all comes together. This is where we want patients to go to seek information, to follow courses if they want, or just reaffirm their knowledge, or look for new modules that maybe were not included in their cohort. So when you just type learning.eupati.eu, this is where you land. This is an all overview of what we are, roadmap, links to glossary, all other resources that we can offer. And then on top, you see a couple of tabs like about, learning catalog, fellow program, FAQ, glossary. I'm just gonna quickly jump through them. So we have some time for questions and answers afterwards. So about page just basically briefly explains you what EUPATI is and why we are doing what we are doing. Learning catalog, and we see here regulatory affairs and health technology assessment, proudly happy as modules available already on Open Classroom. Please go and check them out. Fellow program, all about it, including also the registration form down here and some testimonials. We receive a lot of questions how to become a fellow, and please always come to this page for information. And if you don't find information, always feel free to contact us. Contact details are always included in all those pages. Frequently asked questions, because bigger the information provided, more questions we usually get. The glossary, a wonderful tool for people to quickly check terms that they don't know, because we all come from different backgrounds. And one thing, if we jump back to the landing page, you will notice that learning catalog here, where was it? You don't have to register to Open Classroom to access the information on Open Classroom. And that's a very interesting feature, because it's really free and on-demand learning. So we will not even track you. If you do not want to commit to anything, you're just browsing around, please do so. We are standing for learning as such. So if you just look at the content, go ahead, you can do that. If you feel like you want to get some helpful tools around your learning and your learning plan and progress, then we encourage you to log in. If you are first time here, you just click on register. You have to fill in a very simple registration form, and what will give it to you, it will give you your personal dashboard where you can always access exactly the same information as I showed you before, but you'll have your personal space, and I'm going to show you how it looks like. So if I would be logged in as a user, I would see, okay, these courses I accessed, these activities I bookmarked, maybe I have to reread them, or it's really relevant to me, courses I have enrolled in, certificates. And if I would go back to learning catalog. I see which module I want to take. I click on it. Let's say we want to look into health technology assessment module. Each module contains courses, and courses are again laid out in blocks, so you can freely, and as it was mentioned already, you can choose your own learning pathway. You don't have to follow it linear way. It's very flexible in that respect. And if you click on any of the courses, you will see this Introduction to Health Technology Assessment and Lesson 1, Lesson 2, Lesson 3. You can bookmark all activities, and at the very bottom you will see the assessment. And here comes the interesting part of Open Classroom. The assessment is the only thing that at this point is connected to paying a fee, and that's an €8 fee per course, which allows you to unlocks the assessment, which you, if you pass it with a 7 out of 10 grade, then you get your certificate sent to you. To do that, you have to enroll in a course. If you don't need the certificate, which is also not required a lot of times, do not enroll, please. Don't pay, and you still access exactly the same content. So we do not filter people by their ability to pay for the courses or not pay for the courses. And about the payment structures, we are slowly thinking on how to encourage our users to contact their patient organizations. What are the other avenues for people who cannot afford the €8? There must be a way how they can get the funding for that, but that's something that we have to still work on. Once you follow a course, you always can see here in your dashboard, and you have, if you register, even if you don't really enroll in the courses, if you're a registered user, you have your own profile page where you always can see at a glance what's the status of your learning, with course details, certificates, and then if you lose your certificates in the digital mass of information that we all have these days, you can always download your certificates and access them here via your profile page. So that's in short. I think I would encourage everyone to register, because it helps you to track your learning. And if you feel like you just want to browse around, just go on Open Classroom and feel free to just use the content as in any way you find useful for you. And in the learning organization way, I think we see in Open Classroom learners, and we see ourselves as learners. And this is a fairly new platform. It's online for a year, and there's a lot of feedback we are getting, and there's a lot of growth avenues that we can walk. And I'm really looking forward to see how we can improve the Open Classroom, because it is continuous improvement. We get the very good feedback from users, we get feedback from authoring groups. Authoring groups are doing an amazing job in creating content. Then we have to translate it on a good user-friendly layout in Open Classroom. There's a lot of things to do, and we are getting there. And I think we want to keep also that open mind attitude and to improve it. So this is not the open class. I don't think Open Classroom will be, built as a Rome in one day. It's going to be a process, and we are happy to walk it together with everyone. So that was a glance of Open Classroom. Questions are always welcome via email or just in this session. And I'm going to pass it back to Silvia for a Q&A session. Thanks, everyone.
Thank you. Thank you, Ieva. That was really helpful. And I hope we gave everyone an idea about how the Open Classroom works. But as Ieva also said, please feel always free to send us an email. We've got a generic address info box. So please make sure that you get in touch, and we'll be able to assist you with any questions that you might have. So we've now gone through all the presentations that we had on our agenda. We've got a few minutes before the end for a question and answer session. I know that you've actually typed in quite a lot of questions in the box. So thank you very much for that. We've got quite a lot of interesting questions. We will not be able to go through all of them, but as anticipated, we will collect those questions, provide an answer, and then we will send them out so that you are going to be in a position to understand and to get an answer. I think we can start probably from from a question in relation to the profile of the experts. So we had a question about the profile of the experts. So what are the criteria that has been used to define the expert? What is their background? So maybe Matthias, I can hand it over to you.
Yes,
Thank
please.
you.
So we primarily choose the experts from the pool of people who developed EUPATI over the last 10 years. And the general profile I would define as people with a multi-year experience in the respective area. So on the patient side, we either have involved EUPATI fellows or people who have even before have been on the patient organization, patient side, been influential in developing the training course. And on the side of the other experts, we looked at the universities, for example, the University of Copenhagen here in this case as the academic representative. We looked at people with a multi-year experience in the regulatory field or HTA field. So that is not a specific training course they had to go through first, but we looked at people where we could, from their biography, see that they have the required expertise.
Thank you, Matthias. Thank you. That was very helpful. We also have another question, which is about the co-creation of partnerships between patient organizations and innovators through EUPATI. So the role of EUPATI really as a catalyst. So maybe I would like to hand this over to our director, Maria.
Yes, thank you. And if I understand the question correctly, it's about the co-creation and EUPATI being a platform for creating new partnerships. And this is indeed what the EUPATI Reload project reflects very well, as you've heard today. It is a multi-stakeholder initiative and approach that we always apply. And here we really reach out to our partners and wider networks to bring representation from all different stakeholders around the same table. So I would say this is indeed what EUPATI does. This is aligned with our mission, and we're happy to continue working in this way to further develop patient educational materials. And we are already planning for new modules to be introduced to the open classroom.
Thank you, Maria. Maybe on that note as well, we also got another question about the new modules, so digital health and medical devices. Of course, people are interested and they're keen for the modules to be on the platform. And somebody's asking whether previous cohorts of fellows will be required to complete this new module. So we just want maybe to get an idea about how these new two modules will fit into the program. Thank you.
Thank you. So these are currently optional modules, and we have not added them as a requirement for the fellow program. So we want to welcome you all previous fellows to explore these new modules as soon as they are published, and add these to your program and your certificate.
Thank you, Maria. Maybe also one interesting thing that to say is that in relation to the open classroom and how it works, we are actually planning some walkthroughs. So there will be an opportunity to get people to show them how the open classroom works. So because it may be a new territory, maybe a new platform with some new technology. So we will offer that opportunity from 2022. So again, get in touch. But we will, of course, develop some communication and some information about those sessions, so that also might help people in the future. So thank you. Then we also had a few other questions in the chat about which have already been answered. So I hope that you can all see the questions that was about the language of the open classroom. So we've got a couple of EUPATI national platforms, so the Netherlands and Italy, and they provide actually their courses in the local language. So again, if you want more information or if you want to be put in touch with the other national platforms, by all means, get in in touch, use the info@eupati.eu address, and we will be able also to provide that connection. I think there is also, I can also see somebody asking about creating a network between the fellows and how the fellows can be put, so they can be put in touch and they can be put into communication. Of course, that's also important, and that's something that we can also help with that. So it's important not just to learn, but also to make sure that the connections are there and there is a network of people through which you can learn even more and get in touch and find out about opportunities for meaningful involvement. So as I say, we've got more questions, but we will then provide an answer to all of them. We will also send out a recording of the event. We will also send out a survey just to get an idea about the webinar and maybe areas that you might want us to explore further in the future. So your questions, your answers as well will be informing our work moving forward. So thank you all very much, and I will now hand it over to Maria for some closing remarks. Thank you, Maria, and thank you everyone.
Silvia, and I want to first of all thank all of the speakers and the participants today. I want to also extend a warm thank you to all of our consortium members in EUPATI Reload and EIT Health. This project would not have been possible without all of you. And today it feels a bit sad to be closing this wonderful and successful project, but the work will continue. And so we are very excited to see how the patient education program is evolving and how these new online technologies can also expand the access to this important training program. And we also are excited about the different types of new content that is becoming available. So I want you to welcome you all to explore the Open Classroom and its contents, and please get in contact with us for more information and join this learning journey together with us. And thank you again for joining today.
Thank you so much. Bye-bye.
Thank you, everyone.
Thank you again, everyone. Bye-bye.
Thank you. Bye-bye. See you soon.